Good afternoon. I want to welcome you to our Thursday press briefing with updates on COVID-19. As of this morning, we've lost over 130 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll begin with Albany Mayor, Mr. Bodur. Mr. Mayor.
Thank you, Chief. Good afternoon. I would like to speak to you about where we are as a community. Dr. Kitchen, the Chief of Staff of Phoebe, and Dr. Black, the Director of Emergency Services, informed us when we first started having these press conferences, we would see the light at the end of the tunnel when the number of discharges of COVID patients exceeded the number of admissions for a sustained period. This has occurred over the course of the last month, though there has been an increase in admissions to our local hospitals since May 14th. The numbers, as reflected on the graphs provided by Phoebe Putney, are not particularly alarming, as there have been fewer than 10 admissions on only 1 or 2 days. There were, by comparison, more than 20 COVID patients admitted to local hospitals almost every day between March 21st and April 17th. Additionally, we have been provided with a graph which documents the number of patients in the various Phoebe hospitals. There were over 150 COVID patients in the hospitals from about March 24th until April 19th. The number of patients has consistently declined, though there have been some upticks, such as on May 10th and since May 17th. These positive trends are generally consistent with the benchmarks established by the White House. Thus, I would agree that we should now be returning to work and that businesses should be reopened, subject to the safety precautions we are all familiar with. If you are ill, remain at home. Wear a mask when in public, and consistently wash your hands thoroughly with soap and hot water throughout the day. Businesses, restaurants, and churches must implement additional measures to protect the public. I have been impressed with the genuine concern these institutions have expressed in their actions and their determination to not only comply with guidelines set forth by the governor, but to take additional steps during this uncertain time. One of Teddy Roosevelt's great quotes is, "Failure is not falling down, but refusing to get back up." Our community is resilient, and we have persevered through numerous disasters and setbacks. It is, however, difficult to remain optimistic in times like these. We do not know what the future holds, and we read that some scientists expect a second wave, possibly in the summer, possibly in the winter. If so, we will respond and work with the medical community to combat any resurgence. We will be better prepared for several reasons. First, many citizens will probably have an immunity. Second, Phoebe has an adequate capacity stream, which refers to the number of beds, the number of ventilators, and the supply of PPE. Third, Mr. Steiner has notified us of the invaluable benefit of having successfully struggled with this pandemic over the course of the last 2 months. But we as citizens must do our part, and we must continue to do our part. On a conference call with members of the clergy this morning, there was a discussion of when the churches would return to worship. One of the ministers pointed out that his congregation has continued to worship every day because it is in serving others that they serve Christ. I read with frustration the rants of those who claim the shelter-in-place order and even the request that citizens wear masks is somehow similar to life in a totalitarian state. There are even comparisons to Nazi Germany. We know that the Nazis had no concern for the elderly and the infirm, and that they fiercely prosecuted minorities. I would suggest that we no longer engage with these people. They are of the school, don't confuse me with the facts, I have my mind made up. All the medical research tells us that it benefits and protects others when we wear a mask in public. What we should do is not be concerned about how we are perceived by others, but we should be concerned by how we treat others. The simple act of putting on a mask makes a statement. The person wearing the mask says to everyone he and she encounters, I'm concerned about you. I'm making this change to protect you. When I say we as citizens must do our part, I want to encourage everyone to be tested. We have the opportunity. We need to identify those people in the community who are positive so they can be isolated and take steps to protect themselves and others. And in that regard, I want to again make reference to the fact that the Department of Public Health will be operating a pop-up site at Robert Harvey Elementary School, 1304 2nd Avenue, this Saturday between 9 a.m. and 12 p.m. I want to encourage all residents, particularly people who live in the Jackson Heights area, and for whatever reason have been unable to come to the site behind the Civic Center or go to Slappy, to take advantage of this opportunity. That is Saturday between 9 and 12. Thank you for your attention.
Thank you, Mr. Mayor, for your comments today. We will now hear from Dougherty County Commission Chair Christopher Cohelis. Mr. Chair.
Thank you, Chief. Thank you, Mayor. As always, I want to begin by offering my sincere condolences to each of the families that have lost loved ones during this pandemic. You continue to be in our prayers. We continue to ask all of our citizens to pray and minister to each one of those families. We are emerging from and have emerged from phase one, or what some people call phase one. Some people would say it was, the initial onslaught of the pandemic. We have gone through the different emotions that a community goes through when you have an infection rate as high as we did. We've been through worry, chaos, absolute, some people have been frantic. We've seen a large number of people die. But what we have seen is this. We have flattened the curve, and we're now in the middle of a model that has been scientifically projected. And frankly, there's a lot of common sense about what we know can or will happen. A lot of people have said that these are uncertain times, and I agree in many ways that they are uncertain. But there are certain common sense things that are certain, and I want to talk about that for a second. If you'll look at the screen, we've been talking about flattening the curve. And I think it's important for us to continue to put pictures in our imagination and our understanding with what we're actually talking about. So if we look at, the initial spike that we had in the community, that top end, that red curve on the very front, that was an environment where no one knew anything about social distancing, where people weren't carrying hand sanitizer on their person at all times, where people had never even heard of the term of shelter in place, including myself. These were all foreign terms, foreign concepts. We didn't talk about wearing masks when you go to the grocery store, shutting down businesses, shutting down stores. So that was an environment where that initial curve was really, really high. And we're now entering this new phase so that we can continue with our lives, where we do have relaxed restrictions based upon what the governor has issued, so that we can continue on and make a living and produce and do the things that we do, that do the things that define us as people, as citizens, as a community, as an industry, as a business community, to do all of those things that are necessary in order to provide for our families. And when we talk about maintaining or continuing to flatten the curve, and some people talk about, is there going to be a second wave? Is there going to be a second spike? Here, this is my response to that. Let's just continue to do the smart things. Let's just follow the rules that are in place. We are monitoring things every day with Phoebe. We're very fortunate to have a strong healthcare system in this community that has been capable of standing up the testing and the treatment facilities that we have. We're very thankful and appreciative of the fact that actually we are now positioned that in the event that there is a second spike or a major second wave, we can handle a significant amount of patients far above and beyond where we were when we were at the first curve. And now we're in a different world. And the message I want to carry to the citizens is this. It is time for us for those that are comfortable, for those that are healthy, for those that are capable, to begin to live more normal lives. And because the stress of this anxiety, one cannot live in constant fear every single day that every single decision or any single action may end up killing them. And we know that is completely correct for the vast majority of people. We do know that there are people that are medically fragile, the elderly, and several other folks that have certain discrete medical conditions, the majority of which that many of those citizens can be very vulnerable to the coronavirus. But what we have to do is to continue to find smart ways to continue with our lives. And we've now entered a phase where we can begin this transition, where restaurants can open. And I want to say I've been very thankful, very appreciative of watching how businesses have been smart. I've seen the restaurants that have got the tables, seated apart in a certain fashion. I saw Locos the other day. They had all of their dining outside and made sure that folks were spread apart. Having people in the restaurants actually wearing masks, barbers wearing masks and wearing gloves. People are going the extra mile, and I will say this, it has made a tremendous difference in a community that was at one time number 3 in the world for purposes of per capita infection. And that means a lot. And these are the types of creative things we're going to have to continue to do in order to move through this, because I'll say this, being on a complete lockdown is not sustainable. It's not sustainable for a community. It's not sustainable for mental health. It's not sustainable for maintaining civil order. When you have people locked at home for that long without the ability to engage in a community in any meaningful fashion, nothing but problems, chaos, and mental health problems can result. And I've seen this before in my past capacity when I was a prosecutor, and I saw the civil unrest and the byproducts that came from a complete economic depression after the bubble burst in 2008. And I watched as domestic violence cases, rose significantly. So I say all that to say this, we have to continue to move forward in a tailored fashion. Let's follow the smart advice that's out there, but let's also not spend too much time worrying about whether or not the sky is going to fall every single day. We know that certainly for some it has fallen. We're absolutely passionate about expressing our sorrow and our condolences to the families that have lost those family members. But we are thankful that we have achieved so much and that the large number of people that we have had recover in this community. We continue to urge everyone, practice smart things like social distancing, get tested, find creative ways to engage in commerce, whether you need to order your food online or order your groceries online. Do what you need to do, but also begin finding a way to start engaging in smart, deliberate, and reasonable ways. Because I think that that is going to be really what defines us and has defined some other communities and how they begin interacting as a norm or a more normal community. And we have a task force that meets several times a week virtually, and we talk about a lot of these issues. And some of the things that are going to be part of our lives for at least a significant period of time are going to be masks. And the more and more I read about masks and how helpful it is in preventing the spread of the virus, I think that's something that really needs to be woven into the culture of our community for right now. Because masks and keeping your hands clean and not touching your face and social distancing, those are the types of things that are going to allow us to better re-enter a community that isn't locked at home, scared and afraid every single day that the sky is going to fall. Thank you.
Thank you, Mr. Chairman, for your remarks today. We will now hear from an update from Phoebe Putney Memorial Hospital. The Chief Medical Officer, Dr. Stephen Kitchen, will provide the update. Dr. Kitchen.
Thanks, Chief. One of the things that Phoebe has attempted to do day in, day out is to be very, very forthright and transparent in terms of the extent of the COVID epidemic and the COVID pandemic that we're seeing in Albany, and the number of patients who are admitted every day with COVID-19, as well as the number of patients in our hospital and in our health system with COVID-19. One factor that significantly enhanced our ability to know definitively what those numbers were was the ability to test all patients being admitted at Phoebe Putney with a rapid in-house test for COVID-19, where within a matter of hours, we knew if those patients were testing positive or negative for COVID-19. That was truly a game changer in our mind for several reasons. First of all, it allowed patients and families to know what the status, their status and the status of loved ones was. Secondly, it allowed us to know the status and properly place those patients on the appropriate unit in the hospital, whether that be a nursing unit that housed COVID-19 patients or one that did not. And the same applied for our intensive care units as well. Thirdly, it aided tremendously in reducing the exposure risk to staff, other patients, that sort of thing, and prevent unknowingly transmitting virus throughout our hospital to other patients and that sort of thing. And lastly, it also allowed us to conserve the amount of personal protective equipment we use, knowing what the status was of every patient who entered our hospital. The test we've been using is, I think, truly one of the best tests that's out on the market. It's FDA approved, and the only disadvantage, it's become a very, very popular testing methodology. So we are one of hundreds of hospitals that use that testing methodology across the nation, and we have several large hospitals within our state that use exactly the same testing methodology that we do, including the Medical College of Georgia in Augusta. So what has happened is that the number of testing kits, reagents, we're able to secure and be allotted has really become to decline. And actually over the weekend, we ran out of kits. So we were no longer able to do rapid in-house testing, but rather depended on sending those samples to a large commercial lab, which typically takes about 72 hours to get a turnaround on those tests. So what has been reflected here recently in the numbers that we release is not only the number of patients who test positive and have a confirmed case of COVID-19, but also those patients that we refer to as what's called a person or a patient under investigation. That's a patient who presents with the typical signs and symptoms of COVID-19 that we're testing, but their test results haven't returned. So their status is really unknown at that time, and that's what's referred to a person under investigation. What's been a little bit confusing is that we have many patients, and in fact, I think we had 189 patients this morning who were admitted to the hospital with conditions that, seemingly are totally unrelated to COVID-19. And they're what we refer to as non-COVID patients. However, like I say, we have made the decision to test everyone. I think that's a very, very sound rationale, knowing what the level of community transmission has been. However, those patients also have outstanding tests as well. So I think sometimes it gets confusing because sometimes they get lumped into that number of patients under investigation where actually they do not fit the CDC definition of a person or patient under investigation. So I apologize for any confusion that may have caused, but I do want to be very, very forthright and very factual in what I state. So, with that being the case, currently, across our 3 hospitals, we have 48 confirmed cases of COVID-19. Those are patients who present with the signs and symptoms of COVID-19 and have a confirmed test. 42 of those are at Phoebe Putney in Albany, and 6 are at Phoebe Sumter. We have a total of 27 PUIs that, like I said, those are patients who have the signs and symptoms, but we're awaiting their test results. Of those 27, 23 are at Phoebe Putney in Albany, and 4 are at Phoebe Sumter in Americus. In terms of mortality, like I say, regrettably, since the beginning of this pandemic in Albany, we have had a total of 122 patients that have died, expired in our health system, 94 of those at Phoebe Putney and 28 at Phoebe Sumter. I will tell you, because I think of the dedicated efforts of our physicians, our nurses, our respiratory therapists, what we are seeing is that our clinical outcomes are continuing to improve. that the overall mortality rate for patients being admitted to any of our hospitals is 18%. That compares to a national average of 21%. If you look at the mortality for patients in the intensive care unit who are on a ventilator across our hospitals, that number is now below 70%, and it continues to go down. Again, that number is actually lower or better than what the national averages are at this point. There's a lot of work to be done as our understanding of this very, very complex virus continues to evolve. Over the last 24 hours, we had 6 patients who were admitted with COVID-19 and 7 discharges. And although those numbers may fluctuate some from day to day, and we did see a spike 2 days in a row. It's gone down, and I think those numbers continue to plateau at this point. I think speak to some of the issues that our mayor and the chairman of our county commission have raised in terms of how we have responded as a community, and what does the future hold in terms of how we collectively respond to this. Because there is no question, a pandemic will come along once in our lifetime, if that. And we have seen if there's not the appropriate response, what the human toll can be, not only in suffering and death, but just the impact that it has on people's lives, both economically, emotionally, that sort of thing. And, I do want to state there is a way through the storm and to get on the other side of the storm. And I think many of those practices have already been spoken to. And what I want to convey is this. I think there is a way to drastically mitigate the risk of infection and the risk of transmission, but at the same time allow people to begin to resume normal lives. And so I think it's my belief that if we continue to act responsibly, we can drastically reduce the incidence of this very, very devastating virus in our community. And I think there's an evolving body of science that is now showing that if we take, as a society, those responsible behaviors, I truly believe we're capable of cutting that risk of transmission and infection probably by 75 or 80%. And if we're capable of that, that will truly decimate the impact of this virus on our communities. So we've talked about those common sense, time and true methods from an infection prevention standpoint. We know hand washing is the oldest, the simplest, but the most effective single measure that we can take. Good hand washing and disinfection. We know, based on the characteristics of this virus, how important maintaining 6 feet or further apart is, it drastically reduces the chances of transmission when people gather in social gatherings, whether it be at a restaurant or whatever. But the last thing I want to speak to, and again, this is an evolving body of evidence, is how effective wearing a mask can be. A surgical mask, and I'm not talking about an N95, I'm talking about a simple surgical mask, can reduce that rate of transmission by over 90%. And Phoebe is going to be very, very actively involved with the rest of our community in the Mask Up Albany campaign, because I truly believe it could have a profound influence on reducing COVID-19 in our community. A simple cloth mask that I'm wearing right now, probably can reduce that by 75% or more. So I just want to close by saying, certainly we're in a partnership. We're in a partnership with our city and county, state and federal agencies, but more importantly, community is part of us, and we're in partnership with our community. We want to continue to be very, very forthright and transparent with what our numbers are, because we've got to address that collectively and together. But again, we also want to promote those behaviors that we really feel are going to be extremely effective in the days and months ahead. So thank you.
Thank you, Dr. Kitchen, for the update from Phoebe Putney Memorial Hospital. We will now hear from an update from the Department of Public Health. Dr. Charles Ruiz is the director of the South Georgia District, and we'll ask Dr. Ruiz to come forward for some remarks. Dr. Ruiz.
Thank you, Chief. Well, we have all heard some good news today and some good information and some good recommendations. And I would just like to echo very briefly that I agree with what's been said, that the curve has been flattened, that we're moving forward with fewer infections, fewer hospitalizations, and it is encouraging for sure. But I should also point out that we're not out of the woods. We are still in a pandemic, and while it may be very beneficial physically and emotionally and spiritually and financially, it may be good to move forward and get closer toward a normal lifestyle. We need to do so with wisdom, and we need to take precautions just like the ones that have been spoken about here today, wearing masks, keeping our distance from people, good hygiene, and also particularly protecting those who are most vulnerable in the population, people who are elderly, particularly over the age of 65, people with chronic disease, particularly severe heart disease and lung disease and kidney disease, diabetes, and immunocompromised situations. Those folks really need to continue to segregate themselves and be very careful about any time that they get out of the house or mingle with other people. I also agree with what's been said earlier about testing for COVID-19. It helps us to, in general, know more about the health of a community, and it also helps us to identify individuals who themselves are carrying the virus, so that they can be advised to properly isolate themselves until it's safe for them to mix again. With that being said, there are quite a few opportunities for people to get tested. Here in Dougherty County, for example, many medical practices perform their own collections. And also the joint effort between Augusta University and the National Guard continues here in Albany, and they are doing a good job. That's one easy source to be tested. Another source, of course, is through public health. And I would like to go over the locations that are coming up over the next few days. These locations will be today through Sunday. So in Decatur County, testing will be available this Saturday, March the 23rd, and I'll correct myself when I say testing. We are really collecting specimens that will be sent off to a reference lab for testing. And in Dougherty County, collections are going on today and tomorrow at the health department, and then again this Saturday morning at the Robert Harvey Elementary School. In Grady County, collections will take place today and then this Saturday morning. In Mitchell County, collections are scheduled to take place tomorrow and on Saturday. Also in Mitchell County, down in Pelham, collections will take place today at the depot. In Terrell County, collections will take place tomorrow, Friday, and then this Sunday morning. In Thomas County, collections are going on today at the health department, and then again tomorrow across from the Wright Street Mini Market in Thomasville. I'd like to also say that all of these collections depend upon cooperative weather. These are done outdoors, and when rain comes up, or when the winds are blowing, or when there's lightning around, we have no choice but to discontinue the collections. And then also on Memorial Day, we have collections going on in two communities. In Thomasville, on Monday morning, Memorial Day, at Mount Sinai Apostolic Church from 9 a.m. to noon. And then that afternoon in Thomasville at the Cross Creek School from 2 p.m. to 4 p.m. And then again on Memorial Day in Leesburg at the Lee County Health Department from 9 a.m. to 12 p.m. The way to schedule an appointment is very simple. A person can call 229-352-6567 and schedule an appointment for any of these locations. 229-352-6567. It really does help if you call ahead and make an appointment. That way we can make sure we have the personnel and the supplies that we need, and it'll be done in an orderly fashion with minimum wait time. If an appointment is not made or cannot be made, we still will work a person in even if they just show up. But our preference would be to make an appointment. So if you're willing to get tested, we can do it. There are no criteria, whether you have symptoms or not. You can get tested. We would like to urge everyone to consider doing this. Thank you.
Thank you, Dr. Ruiz, for your report today. The coroner had to leave. He was called out to a call, and he wanted me to report that there have been no changes, and that in Dougherty County, we stand at 137 deaths as of today. We'll pause a moment for any questions from the media. I do have a few announcements before we conclude today. Are there any questions? Yes. Dr. Ruiz is already left, but we can certainly get your question to him and be happy to ask the mayor to come up to take your question. Mr. Mayor?
And my question to Dr. Ruiz,
Commissioner, if you would, just stand by one moment. I want to make sure that.
my question, if you can forward to Dr. Ruiz, to Dr. Kitchen, since we know there's a lot of underlying issues in this community, like especially in areas that where there's a large concentration of people of color, do you think that this task force need to continue since medical experts and scientists have said that we're going to have a second wave that would sometime come in the fall of the year? That would be to the medical profession. Do we think that we need to expand continuation of it? And my question to the Honorable Mayor is that this is a holiday. If we see individuals at parks or recreation facilities, a crowd of over 10 or 20, what should we do? Should we call the police department or just let it go on?
Chief Scott, we need to call the EOC, don't we? Would you give that number, please, sir? That's the,
We would urge our citizens to call the Emergency Operations Center, 302-1900. And we will then make sure that concern is reviewed and looked into right away.
Okay, and if they call, would they have to give their name? Could they just say they're anonymous caller and these are young boys and girls down at one of the parks playing basketball and there's about 30, 40?
They do not have to give their name.
Okay.
No. Thank you. Any further questions for the mayor? Okay, Mr. Mayor.
Hey, really is for Dr. Kitchens, but I guess I could try and see if you can answer it. Do you think the decrease in numbers is decreasing rapidly or slowly? And is there anything that we can do to make that process faster if it's slow?
well, that's again, it's a medical question, but I think what Dr. Kitchen, his term was, we could dramatically mitigate the community transmission by just following these precautions of social distance and wearing a mask or face covering. But I can give you the most recent graphs that document the decreases in admissions and also the decreases in the number of patients who are hospitalized.
Thank you.
Any additional questions? Okay. Before we conclude today, I would like to give the Emergency Operations Center number again. It's 229-302-1900 as we approach the holiday. If you have a compliance concern or issue, please give us a call. We're open 7 days a week. Also, I want to speak to next week. We will not have a press conference on Tuesday. Our next press conference will be on next Thursday. We will not have one Tuesday due to the holiday on Monday, but we will be back here on Thursday at 1 p.m. For our updates on COVID-19. As we end today, we remind everyone as we go into the weekend, very simple, mask up Albany, mask up Dougherty County. Thank you and have a great day.
I appreciate you saying